Jill, hi, it's so great to chat with you. Tell us a little bit about like who you are and we'll go from there.
Okay. I'm Jill Minks and I live in central Wisconsin and I'm a mother of four children, grandmother of six, and recently widowed 2.5 years now. So that's a whole new journey to be living honestly on my own for the first time in my whole life.
Yeah, wow. Yeah.
So it's somewhat refreshing in some ways, and then in other ways, the most lonely thing I've ever gone through. So,
Yeah.
stress of all of that and things like that definitely played a factor into, I think, what ultimately impacted me in getting cancer. So,
Yeah, tell it. Thank you for being so transparent and open and I couldn't possibly imagine what you're going through because I haven't been in something similar, but my logical brain says that's a lot and a big transition
yeah,
and life altering for sure.
life. Yes, for sure.
Yes. Um, Tell us about your health journey.
Sure. Um, I I mean, it's a long journey, but I was a girl who didn't really exercise or anything like that. I mean, other than maybe walking with my children and stuff. But about 13 years ago, my husband and I had found CrossFit and decided to start getting involved there. And through CrossFit, we really cleaned up our lifestyle, cleaned up our food, our eating, started eating more paleo, and then also started realizing as I was aging that I had a good amount of arthritis, a good amount of chronic inflammation. We did a little bit more running before we did CrossFit, and I had a ton of pain in my hip area, started realizing I had some lower L4 and L5 degeneration going on. So I began to start looking for ways to alleviate those sorts of pains. And I would say 5 years ago, I found cryotherapy where I met Lane and we started first of all just doing the cryotherapy, and then when they received the red light therapy bed I wanted to start incorporating that into my life as well. I waited maybe about a year, but as I talked to other guests that were coming to cryotherapy, they were like, oh, they really noticed their healing just jumped that much farther and their skin got better. And I was like, oh, who doesn't want nice skin? So I jumped into doing some of that, and then about a year and a half after my husband died, I was diagnosed with breast cancer. And so I knew
Mm.
then that I definitely was going, I mean, I was kind of blown away because I was like, I'm doing healthy things, I'm exercising, I'm eating good, I'm doing cryotherapy. And I think it was just the culmination of lots of different things and stress and not functioning at a healthy metabolic level. I ended up being diagnosed with breast cancer. So,
Yeah, what was it like when you got that diagnosis for you?
well, like I said, I was surprised, but in a way, not surprised because my mother and all of my aunts on my mom's side of the family have all had postmenopausal, so late onset breast cancer.
Mhm.
Um, raised in a family of all girls, I somewhat expected that several of us will have it, according to the statistics today.
Mhm.
But
Mhm.
honestly, I believe the stress level. Even my radiology oncologist had said that many times after a death, people end up getting cancer because it's such a stressful time. And those are the things. Inflammation, for sure, is what the biggest contributor to cancer is. So,
Mm.
as I wanted to treat things as naturally as possible, and so I found a radiology oncologist who also treats at a metabolic level. So she treats with food and all that sort of thing. And I definitely wanted recommendation because I ended up with a lumpectomy. They did get it all, so that
Mhm.
was good. but we're recommending 21 days of radiation. And from that, I didn't know that I even wanted to do that much, but I met with her and she recommended that I start with the radiation the way that they're recommending. But um, if it got to be too much, or I had too much consequence, or, burning in my skin or whatever else, then I would, I could still say, hey, I'm quitting. I'm done now. I'm not going to finish the 21 days. So that's what I did. And my kids were nervous, so they wanted me to do radiation because in our mind, we think all of those things are what stop, cancer from coming back.
Mhm.
So I asked my radiologist, the one here, not the functional medicine one. I asked him what he thought about cryotherapy and red light therapy, which he knew nothing of.
Mhm.
Had to explain it to him, and after he said he would have to look into it a little bit more and then let me know. And he did come back to me and say, it doesn't seem like that's going to be any problem for you to incorporate that with your therapy. So, yeah, go ahead and do that. So, right away from day one, I did. And I did the red light bed at least 2 to 3 times a week on top of my normal cryotherapy, as well as utilizing the Nano V. Um, and I ended up going through radiation and having literally not even any peeling of my skin. I had barely any redness. Probably by day 18 or 19, it just started to have a little bit of a pink tinge to it. And the doctor was quite surprised, to be honest. He was, I mean, every week you go in, well, I went every day for 5 days, and then I had the weekends off. And every week you go in for a checkup. And he was like, wow, like you have nothing. And I didn't even feel anything. I can't say that I even, other than towards the end, I started to get real tired. But that was it. I would say tired was my biggest consequence from radiation. So,
So, for those of us who aren't familiar with what typically happens to people's skin when they are getting radiation, and you were saying you had nothing, didn't have you only had a little bit of redness come day 18. Can you share with us like what typically happens to people's skin when they're getting radiation so that we can really see the contrast between
sure.
like what most people experience versus what you experience because you were coupling it with cryotherapy and red light?
Sure. Well, the first thing they say is that you're going to end up with like almost like a burn, like you would, and especially be very careful, getting out into the sun and that sort of stuff. So you may experience a burn, you may experience tightness, tingling, you might experience peeling of the skin, some oozing. Your skin could open and get open wounds and ooze. Um, and I can't even remember all the consequences, honestly, but they were definitely things where you're like, wow, how in the world would anybody be willing to sign up for this?
Okay.
I mean, so, those are basically the things. I mean, you're going to be tired. You're going to be, you could have joint pain. Apparently, you could even crack a rib. I mean, there's so many things that can happen. So, yeah, it's a little scary going in. You're like, wow, I don't know if I dare to do this. And then they give you a cream, or it's called calendula lotion, and they recommend that you put that on daily to help with all the dryness and stuff. And I happen to make my own sort of healing balm thing out of essential oils and calendula. And I used that instead of the one that they gave me. And I literally didn't experience anything at all.
Mhm.
So,
Mhm.
and then even afterwards, I went on a vacation to Mexico and they said, make sure for the whole next year, stay out of the sun, keep it covered. And I didn't. And I didn't even get a burn. Nothing, nothing different with that part of the skin to the other. So I completely attribute it to, using healthy alternatives, especially the red light therapy. I think that ended up making a big difference. So,
Mhm. So what I'm hearing is that while you're going through radiation, it's very common for people to have a lot of side effects from the impact that it's having on the skin. You used red light therapy and cryotherapy. while you were getting this done, and your doctor was quite surprised to see how minimal your symptoms were. Like you said, rashing, redness, open wounds, pain, tingling. You didn't experience any of that, and you attribute that to using the red light in conjunction.
Absolutely.
Incredible.
It really was. It was, and even my kids were like, "You don't even seem like you're doing anything, mom. There doesn't seem to, and I'm a hairdresser, so I kept working the whole time.
Wow.
So, just didn't experience anything. So, it was
Mm,
pretty cool.
yeah. So if somebody's watching this and they're dealing with a health issue, maybe it's cancer, maybe it's not, and you could share with them some of your own wisdom from your personal experience taking care of your health, going through this journey, starting paleo, CrossFit, utilizing these alternatives, what would you say to somebody else based on what you've learned?
Even if you think something might be controversial, if you will. There's those things out there like, oh, it's not going to make a difference. I mean, I've been a cryotherapy user for 5 years now, and I have every year when my um, membership runs out, I think, I don't need this. It's not making that big of a difference. And then about a month later, I'm like, oh my gosh, I'm so sore. I'm so whatever. And then you start again and it builds up on each other and gets so much better. But I would say don't be afraid to try it.
Mhm.
Don't allow the excuses that say, oh, it's not going to make any difference because you just don't know. I mean, I think it made all the difference in the world for me. Um, Absolutely 100% believe that doctors need to be more educated on alternative therapies because they have no idea that people don't just have to live with the consequences of all the things that they say, could possibly happen when you can do alternative things in combination. Um, I think it'd just be so powerful for the practice to be able to offer that to people that don't know about it, and physicians should learn and know.
Yeah, yeah, and I'm hopeful that your doctor is telling other clients, given the fact that they were so surprised that you
Right.
were not experiencing all of these side effects from the radiation, and having shared with them that you're combining it with light and cryo, like, I hope that they're sharing that with their other patients, even though it's anecdotally, right? Like, your experience is individual and anecdotal. It's not like from this large, like, meta analysis or whatever, but
Right.
still, like, if it's worked for you, I hope that they're sharing that with their clients, and I agree with you. I definitely think that, like, doctors are primarily, to my knowledge, educated on, like, illness and drugs
Right.
and, like, medication
Let's
and
just treat
prescriptions.
this instead, and these are the consequences, but rather than like, wow, there's alternatives out there.
Yeah.
So,
Yeah.
agreed.
Well, hopefully this goes viral and more doctors see it online.
I hope so too.
Me too. I also do. Thank you so much for your time today, Jill. It was great to chat with you.
You're welcome.